We're hearing a lot of experts talking about COVID worsening this fall, and we've even heard the term twindemic being used. So we're checking in with Dr. Keyna Martinez. She's medical director at Beacon Medical Group Bremen. Dr. Martinez, tell us what all this is about.
Well, Heidi, as we all know, COVID-19 hasn't disappeared yet, and it's still circulating in our communities and even across the world still. What we're concerned about in the medical community is what's going to happen to patients when influenza comes back in the fall again. What many people may not be aware of is that about the time we started to really be concerned about COVID-19 in this country, influenza was still going strong in our communities. And we know that testing for COVID-19 wasn't immediately available in February and early March in many places. But we were testing people with unusually severe influenza cases that were in our hospitals. And once testing for COVID-19 became more widespread, there were definitely people that were coming to our hospitals with both COVID-19 and influenza together. And so our concern is that the improvement we've seen in mortality over the summer has less to do with the treatments that we found have been helpful and more related to having people who are less sick because they're not getting flu and COVID together, or one right after the other and having all of that additional stress on their body and immune system.
So this is a year where we're hearing it's important, if not critical, that we get our flu shots. Will this keep me or keep people from getting COVID-19, or what does it mean?
So COVID-19 and influenza are two separate viruses, but we do have a vaccine for influenza, and it's a very effective vaccination. So we recommend that everybody get vaccinated against flu, because if we can at least keep people from getting flu and COVID together or one after the other, then their survival will be better. And we know this not just based on rational science or logic, but there were studies that were done and released this summer that showed individuals who got a flu shot last fall and got COVID-19 sometime during last winter were more likely to survive the COVID-19 than individuals who did not get vaccinated against influenza. So a flu shot won't keep you from getting COVID, but it might keep you from dying from COVID, and that's a very important benefit of the vaccination.
Absolutely. So it seems that some years we hear the flu shot did or didn't work. Do they really protect people, and why that inconsistency?
So that's a great question. Every year there are multiple strains of influenza that go through our communities, and there are three common families that we typically see: influenza A, B, and H1N1, or the swine flu. But every fall and winter we might get different types from each of those families at different times throughout the flu season. So last year we had a little bit of swine flu in early October, and then we had A influenza kind of around Christmas time, and then there was more of a B influenza in January and early February, and it can change like that every year. So each year they predict which flu strains are most likely to circulate the following winter, and then try to match the flu vaccine to cover those particular viruses or those particular subsets of the virus. Some years they do a great job and they predict it perfectly, and other years they might miss one or two of those strains and it might not be quite as good a match, and then that's when we hear that the vaccine's not as effective for a particular strain in a particular flu season.
So the flu shot has been around forever. Is the flu vaccine safe?
The flu vaccine is very safe, and people need to remember we've had a flu vaccine regularly available in the United States for over 50 years now. Millions and millions of Americans and people around the world get vaccinated from influenza every single year. It is probably one of the least risky things that we do in our life. Driving cars and other things are more likely to result in harm, and we can get a flu vaccine with absolute confidence that the vaccine process has made us the safest vaccination possible. It is certainly much safer than waiting and catching flu yourself, where you're likely to be sicker longer, and the risk of being hospitalized or having a very long recovery or even death is much higher from the actual illness than from the vaccine.
So does or can the flu shot make you sick? I bet you get asked that a lot.
We do get asked that a lot. Some of the confusion comes that people are usually getting vaccinated in the fall and winter when there are lots of other viruses that tend to be passed around. If somebody gets a cold, a runny nose, sinus congestion, that's a different virus that is not even related to the influenza virus. So the flu shot doesn't give you a cold. Another thing I see people be confused about is vomiting and diarrhea. The stomach flu, again, is a completely different bug. So a flu vaccine won't keep you from getting the stomach flu. It also can't give you the stomach flu. So those distinctions are important to keep in mind. A lot of people will get a sore arm after a vaccine, and that usually lasts for about a day. It feels kind of like you've worked out too hard, or maybe somebody punched you in the arm really bad. But otherwise, it's very tolerable. I also see some individuals notice a little bit of their immune system ramping up. They may feel just a little bit of a headache, maybe just a tiny bit of tiredness, kind of enough to say, am I going to get sick? And then it's gone before you can even register that you feel different. That also is common with the flu vaccine, but anything more serious is usually from a completely different organism and not related to the shot.
Okay, so say you put off getting your flu shot. Say you're busy, you put it off for several weeks, and in that period of time, you come down with the flu. Is it still important to get vaccinated?
Absolutely. So remember again, multiple flu strains circulate throughout the year, and there certainly are people every year who get 1 or 2 or even 3 of those different flu bugs. So just because you've had influenza once doesn't mean you cannot benefit from a vaccine. And we especially recommend that you still get vaccinated to protect yourself against the other strains that are circulating or will circulate later in the year.
So now is the time to get your flu shot, is what you're saying. Is there anyone who should not get a flu vaccine?
Well, the flu vaccine is not recommended for babies under the age of 6 months. So 6 months and under, babies should not get vaccinated for flu. And that's why it's really important, if you have an infant or a young child in your house, everybody else in that household should make sure they're vaccinated. So the parents, older siblings should get their vaccines to help protect that baby until they're old enough to get their own flu shots. Other people who shouldn't get a flu vaccine are those who have had a prior serious reaction to a flu vaccine that required treatment in an emergency department. Everyone else can safely get a flu shot. Many people who have egg allergies were told in the past that they shouldn't get vaccinated with the flu vaccine. That is no longer the recommendation. The CDC did a very thorough study a couple of years ago that showed even for people with the most severe reactions to eggs, it is safe for them to get a flu vaccination. They just need to be monitored at their doctor's office for about a half an hour afterwards. But those who have not had a life-threatening reaction to eggs can get a flu vaccine like anybody else with no precautions or additional care.
Okay, so on a final note, on a personal note, do you get a flu vaccine?
Absolutely, every year. I spend about 4 months every year watching people get sick from flu and watching how long it takes for them to get well. Even unfortunately watching some of my patients die from influenza or the related pneumonia that they may get afterwards. So this isn't abstract, it's very real for me. I see what it does to people, even people who usually are healthy and have no problems. The vaccine is very safe, it's extremely effective, and it's so much better to get a little pinch in your arm and have it feel sore for a day than to be down for 3 or 4 days or 3 or 4 weeks or months recovering from influenza.
So true. Dr. Martinez, thanks so much for your perspective and advice today.